folks, a rather troubling story in the Gazette over the weekend, and it was on the front page. Dr. GERALD BATIST, who is, I think, fair to say, one of the, how would you even put this, one of the top cancer doctors, maybe, certainly in the country, maybe in the world.
Yeah, renowned.
Who, thankfully for us, is working at the Jewish General Hospital at their Segal Cancer Center. Now, it's interesting because when I called, I call him Jerry because we went to elementary school together. So first of all, Jerry, thank you for being here this afternoon. I hope you don't mind. Is it okay for me to call you that? I'm just, you're the reason that my mother says you went to school with Jerry Batist. He became a doctor. Look what happened to you. So,
oh my heavens,
you've done okay for yourself. But I want to address this story because this was a real, I'm sure not just for me, but an eye opener for many people to read. Cancer deaths could soar by as much as 25% in Quebec. That's what you said. And people look at that and go, wait a sec. How is this even happening now? So what's going on exactly here? And why do we have to be concerned? Because those are pretty stark numbers.
Yeah. Well, first of all, I'm glad to be with you today. This was not meant to be a real downer and nor to alarm people, but to really advise people of what's going on. And this is not really a Montreal, a Quebec, or even a Canadian problem. This is an international problem. And this really all stems from the pandemic. The early modeling that I think we talked about a couple of years ago suggested that there would be increased mortality because of delays in diagnosis during the first wave. People didn't go for their scans and their mammograms and colonoscopies. But we're now seeing that actually the effects of the pandemic are cumulative and chronic. We're missing personnel. Everyone understands in every walk of life, in every business, and so too in healthcare. We're missing nurses, technicians, even physicians. We're short on staff. And then every once in a while, someone tests positive and is obligated to be out for a week. And so without understanding how long this was going to go on, we've now understood that there's a cumulative effect. And obviously, this is impacting patients as well. So we're seeing this, and we don't know the real numbers yet. We're still collecting them, but we're seeing patients presenting with much more advanced disease than they did in years gone by.
Yeah, and the part that's troubling to me, I mean, yes, we understand cancer clearly is still here, but this quote is we're seeing younger people with more advanced disease. That in itself is troubling.
Well, that's right. It's alarming to us as well. So people that would have been picked up in screening, there were some increases in any case happening in some diseases, for example, pancreas cancer, even breast cancer, hereditary breast cancer, which occurs in younger people who need to be screened more rigorously. So we're seeing that as well, but we're seeing it across the board. I say younger people. I also say more elderly people. It's really across the board. Now, one of the things that really wasn't highlighted in the article is that we're all trying desperately to find solutions, and we are finding solutions. There are workarounds to all these things. So if we have shortages in personnel to do one part of it, then we're finding workarounds, and everyone is working their tails off to fix this. And we all understand as well that just as we found our way out through the pandemic, through research and innovation, the vaccines, that's how we're going to solve this cancer problem. And so we're ramping up clinical research, and we're trying to encourage the government, regulatory agencies, and with their positive response to approve more effective drugs that are coming along. There's always a bit of a delay between Canada and the U.S. And so they're better treatments, and that's how we're going to solve some of these things.
I mean, that's certainly reassuring to hear, but do you think, Doctor, that the government is just kind of fundamentally not getting it? I'll tell you, as you know, I read this article in the Gazette, and you're saying that, there's a huge problem with the shortage of technicians, a human resource problem, and I think about the cutting of Dawson's funding and the radiology department that needed, expansion desperately. So do you feel like this government is just fundamentally missing the boat?
You know what? I don't really. I think... Again, this is a universal problem, but I do think that, when the government says we're going to recruit 1,000 nurses, everyone's looking for that same 1,000 nurses. And so we have to convince those 1,000 nurses to come to Quebec as opposed to France or Belgium or New York or Boston or Chicago or LA or anywhere in the world. That's the problem. These are chronic problems. You can't just grow up a technician like that. At the JGH, we're very lucky to have recruited a bunch of new graduates in radiology technicians, and so they're coming on stream now, and they're going to be great. And we're finding workarounds until everything is up to scratch. I think everyone everywhere is trying their best. Each hospital has different challenges, and the government is not. They're not closing their eyes to this. They want this to be successful. I think there's just straight out a shortage of people. And the people that are remaining and still working at it are getting exhausted.
Sure. You know,
and that's the problem.
I wonder as I hear you say this, though, if the issue is, let's say someone is out there, and yes, I understand people are getting, not just younger, but older people as well, as you said, are getting more advanced cases. So someone who's not able to get a diagnostic test done because there are fewer and fewer radiologists, people to do it, what's the solution here? What do you tell patients to do if you simply can't get that test?
I think there always is a way, and I think the patients have to be more persistent. They have to talk to patient advocacy groups. There's lots of them. They have to use whatever networks they have, and that there's some inequity there. Not everyone has networks into the system, but I think patients have to be very persistent. And I think actually patients have learned to be very persistent during the
Don't have a choice, I guess.
Yeah. You have to be your own advocate. It's sounding to me, so. I'm getting the impression anyway, Doctor, that somehow it might be more realistic that we find a cure for cancer before we're able to fix this problem.
Oh. Yeah, I think I think that's exactly where I'm going with this and what we've been pushing for. We think that innovation and research, and the government has invested and has continued to invest in medical research, biological research, and just moving more rapidly along that line, getting to better treatments that have better outcomes is really the solution that we need.
Just as a final question before we run out of time, I mean, again, the headline sort of tells the story to us, and I'm happy that you added context because it's not as dire, and it's certainly not about us alone. This is, you said, a worldwide problem. But is there something going on, Jerry, that we're seeing more cases in general or not, environmental or otherwise?
No, I don't think so. I mean, I think there were some trajectories for some kinds of cancers. Lung cancer was declining. Pancreas cancer, for some reason, was increasing before pandemic and continues to. The problem is really related to the pandemic and an accumulation of patients that never got diagnosed in time or didn't get diagnosed as early as normally they would. And the normal that we all saw in 2020 and that for a year was a clear vision in our minds that we're going to get back to is hazier now. It's a little hard to get back to that normal, and that's the problem. We're missing people, and the people in the system are very tired. But I think we're going to persist. We're very dedicated to our patients.
Thank God for that.
Yeah.
Thank you so much for the time, Jerry. It's great talking to you. Very much appreciated. Dr. GERALD
Nice
BATIST.
to talk with you.
You bet. Over at the Segal Cancer Center at the Jewish General Hospital. Eye-opening, isn't it? And
it's very eye-opening.
I'm sorry. I just got that weird feeling when, you talk about advocating for yourself. You're like, why do I have to? I used to pick up a phone, go get a test, get an x-ray, get an ultrasound, do whatever you had to do. And then the system got so backed up that you're now having to wait and wait and wait. And by waiting, the situation only gets worse, and they're seeing that in the numbers. Be your own patient advocate. You don't have a choice,
to the greatest extent possible. I mean, you have to be your own advocate.